looks like most of the participants are here and it's slowing down for the entrances. So welcome everyone. Thank you for joining us today for the Caring for the Caregiver webinar presented by the Executive Office of Aging and Independence in collaboration with the UMass Chan. My name is Deanna Nourai, and I'm the Director of Public Health Policy and Outreach at the Executive Office of Aging and Independence, and I am thrilled to welcome you to this important discussion today. Today's topic is protecting your heart while caring for somebody else. So a quick overview. In recognition of American Heart Month, this session is all about practical, empowering ways to support your heart while supporting somebody else. So we're going to break down heart health in plain language, share simple caregiver heart health toolkit tips with realistic micro habits you can start right away, and review some clear guidance on when to seek medical care and what symptoms to make sure that you take seriously. And I'm very pleased to welcome my fellow speakers today. Taylor Jansen holds a PhD in gerontology from UMass Boston. She's currently a postdoctoral fellow in Transdisciplinary Training Program in Cardiovascular Research at the UMass Chan Medical School. Her research expertise includes epidemiology, population health, health disparities, rural aging, chronic disease management, and data visualization and mapping. We also have a pre-recorded segment submitted by Dr. Maxwell Coll, who's a clinical cardiac electrophysiology fellow at the Brigham and Women's Hospital. He earned his medical degree from Georgetown University School of Medicine in 2019, and he specializes in internal medicine. So some quick housekeeping notes before we begin. A quick note for those attending live, please feel free to post your questions in the question and answer box in the chat. You can also submit questions anonymously if you would like. Please do not include any personal or identifying information in your questions, and there will be a dedicated time at the end of the session to address all of the questions. So a live transcript is enabled for this webinar. You can access the live captions by clicking on the CC or live transcript button in your Zoom toolbar. Thank you again for being here today. And now I'd like to turn it over to Taylor. Taylor, if you could turn on your camera and microphone and take it away.
Hi, everyone. Thank you for having me. Like Deanna said, I'm going to start by talking a bit about what is the cardiovascular system, and then I'm going to transition into more things that we can do ourselves to protect our health. So the cardiovascular system or circulatory system, it's a vital network that comprises the heart and the blood vessels, and it circulates blood throughout the body. It acts as the body's primary transportation system because it delivers oxygen, nutrients, and hormones to cells while removing any waste products like carbon dioxide. The heart is a muscular pump with 4 chambers, or the right and left atria, or the right and left ventricles, and that drives the blood circulation throughout the body. The blood vessels are a network for transporting that consists of the arteries, the veins, and the capillaries. The primary functions of the cardiovascular system are to deliver oxygen, nutrients, and hormones to our tissues, to carry waste products out of the body, to protect against disease and help maintain body temperature. And it also is helping us promote oxygen throughout the body. So the right side of the heart pumps oxygen, depleted blood to the lungs so they can receive oxygen, and then it returns it to the left side. The left side of the heart pumps oxygenated blood throughout the rest of the body. So any type of condition that affects this system, like high blood pressure or an arrhythmia, these are what are termed cardiovascular diseases. You can go to the next slide. Okay. So what exactly is cardiovascular disease? You can think of it more as an umbrella term because it refers to many different types of conditions like hypertension, coronary artery disease, heart failure. But the majority of heart disease is associated with what is called atherosclerosis. And you can go to the next. So atherosclerosis is a type of arterial sclerosis, and it causes the arteries to narrow, weaken, and be less flexible. So It's a term for the process of the fatty buildup in the inner lining of the artery. So as plaque builds up, the wall of the blood vessel thickens, and this narrows that channel within the artery, so that reduces blood flow. And it also lessens the amount of oxygen and other nutrients that can reach the body. So where the plaque develops and also the type of artery affected varies with each person. So plaque may partially or totally block blood flow through large or medium-sized arteries anywhere in the body. So that could be in the heart, the pelvis, the legs, the arms, the kidneys. And if a blood clot forms, it can block the blood flow. And this is what can cause a heart attack or a stroke. Move on. So how can we prevent this from happening? Cardiovascular disease risk factors can be broken up into two categories, non-modifiable and modifiable. The good news is, as you can see, the modifiable list is much longer. Non-modifiable risk factors are things that we don't have control over. So things like family history, age, sex, and race. Modifiable risk factors are things like high blood pressure, cholesterol, having diabetes or prediabetes, smoking, obesity, having an unhealthy diet, or a lack of physical activity. High blood pressure increases the heart's workload overall. So it causes that heart muscle to thicken and become stiffer. The stiffening of the heart muscle is not normal, and that's what causes the heart to function abnormally. The risk for heart attack or stroke increases even more when high blood pressure is present alongside things like obesity, smoking, diabetes, and high blood cholesterol. Diabetes greatly increases your risk for developing cardiovascular disease. Even when blood sugar levels are under control, diabetes increases the risk of heart disease and stroke. This risk is even greater if your blood sugar levels are not controlled. There are medications that you can get on to help control your blood sugar or insulin levels, though. Tobacco use is a major risk factor for heart attack and stroke. This is because nicotine, the chemical found in cigarettes and e-cigarettes, causes your heart to beat faster and the blood pressure to rise. Smoking makes clots more easy to form, and it can also promote that buildup of plaque in the arteries or the atherosclerosis. People that have too much body fat, especially at the waist, are more likely to develop cardiovascular disease. Many people have trouble losing weight, of course, but for those above a healthy weight, if you can sustain a weight loss even at 3% or 5%, that can lead to significant reductions in some of these risk factors. An active lifestyle is also a major risk factor for cardiovascular disease. Adults should aim for about 150 minutes a week of moderate intensity physical activity, and that's something like brisk walking. Or you could aim for 75 minutes of vigorous intensity physical activity. So that's something like jogging, anything that really makes the heart pump. Or you can do a combination of the two. That is what is recommended by the experts and the research currently. So what is cardiovascular health? So this is the latest promotion from the American Heart Association, and they have been focused on reducing heart disease since 1924. Heart disease has been the leading cause of death in the US for over 100 years. So recently, they shifted their focus from, really explaining what is heart disease and and focusing on that into how can we prevent it and what are educational resources that they can provide on how everyone can promote and protect their heart health. So to do this, they developed a framework full of components that together make up what they call ideal cardiovascular health. And the components are a mix of health behaviors, health factors, and an absence of clinical cardiovascular disease. So this framework is called Life's Essential 8. It's a strongly dose-dependent framework associated with lower cardiovascular disease events and mortality. So all of these components contribute, but the things like physical activity, nicotine exposure, diet, blood pressure, blood glucose, and sleep appear in the research to be the most influential in protecting our hearts. So all of these components work together. So better scores on the health behaviors, so that is this first list here, diet, movement, sleep, and factors like BMI, blood pressure, um, your lipids levels and your glucose levels. These are substantially and progressively associated with lower cardiovascular disease events and deaths. Go ahead to the next. So why does this matter? I just want to point out that each one of these is beneficial to our health. It is not a one size fits all. You do not have to incorporate all 8 of these things to have a healthy heart and to reduce your risk. If you take up one of these 8 components, it is beneficial. These are not rules. This is not a prescription. They are guidelines or components of a lifestyle that we can aim for to reduce our risk for future cardiovascular events. So what I think is really exciting as a researcher is that since this framework has been published, there has been a host of research that has come out that has tested the efficacy of these components or of this framework. And what essentially it has found is that it is a dose response. So meaning the more components of the framework that people incorporate into their lives over time, the bigger benefit. So, like I said, each aspect is beneficial to your health, but if you practice more than one or multiple of these together, your risk for cardiovascular disease drops significantly. So, if you practice, maybe just eating healthier, your risk will start to go down. But if you eat healthier, you exercise regularly, you sleep better, and you don't do nicotine, that rate is going to, increase even more substantially. So I think it's really interesting, and I think it's very cool research that is coming out right now that is really promoting this components or this framework, right? The American Heart Association that has come up with this Life Essential 8 on their website, they have what is called My Life Check. So it's a free assessment that you can take to better understand your personal risk for heart disease and how you kind of land on this Essential 8 framework. So I think that's pretty cool. So, as caregivers, of course, you have fewer opportunities to focus on your own health. Caregiving is naturally going to shift your attention and your mental load towards the person you're supporting, which is going to leave less time and bandwidth for your own health and your own self-care and your own routines. Time is going to be scarce in your day, and you're going to have competing priorities that take up any free time that you may have. So even so, incorporating exercise or diet changes can be even more difficult because of the stress you're already dealing with. And this stress in general is going to have a big impact on your sleep. And when you don't sleep well, you have less recovery time or bandwidth or ability to be able to exercise, for example, or to make healthier food choices. But the empirical research, the literature has focused on caregivers for years and years, especially gerontological research. They focused a lot on how can we help caregivers. Caregivers are so important to the care recipients, but also to the U.S. healthcare system. As we know, the majority of care in the U.S. is done by informal caregiving, unpaid work, by family members especially. So they've really focused on a lot of research that can try to reduce this caregiver strain and protect against the health of caregivers. So one of the first things they recommend is to build skills and knowledge about the illness and the care. And in turn, this will help you reduce the stress. If you have more education and more training about the condition that the care recipient is dealing with, how to manage the symptoms, how to communicate and problem solve, that will reduce your caregiver burden and depression and stress, especially across the dementia and cancer caregiving. One thing you can do is you can take some structured caregiver training programs, or you can request written care plans from the healthcare providers, or emergency protocols or contacts before you even leave, say, the hospital. Anytime you have, clear written down rules or plans, this will help reduce this decision overload you may be facing. Another suggestion or strategy is to strengthen your social support and to use structured services. So, having strong social support, even if it just means calling your sister and venting, or having neighbors nearby that can come by and you can take a shower and you feel okay doing so and you feel safe, really help to reduce the loneliness and buffer the impact of this burden on caregivers' mental health as well. And you can also engage in more structured groups like peer and emotional support groups, or things like respite care or coordinated care models. These have all been shown to reduce stress, especially for parents who are caregivers of children. There are also a host of digital and internet-based programs like apps, online education, or even online support groups. Since the COVID pandemic, especially, support groups have increasingly turned to Zoom to meet instead of having to find time in person to meet. So there's more availability of that. And lastly, it's important to protect your mind and body, of course. So one way you can do this is to start doing mindfulness based interventions or mindfulness based practices to help reduce your stress as a caregiver. This has been shown in the research to have a really strong impact on caregiver stress. Another thing you can do is try to aim for some regular or realistic activity. So this is one of those things that any activity is better than none. If you can take a 15-minute walk, if you can throw on a 10-minute YouTube video or 20-minute YouTube video, that's great. If you can start doing, asking your neighbor down the street or your friend to go on 30-minute walks, 1-hour walks once a week, anything like that, any type of planned exercise, any type of realistic activity is going to be good for you, for your health, yourself, of course, but also for your mind. It's going to give you this little reset that you are going to need in your stressful day. So that is everything from me. I'm going to hand it back to Deanna, who will walk through several resources in Massachusetts that you can tap into to support these protective factors.
Thank you so much, Taylor. So we're going to go through some more resources that are available in Massachusetts that can help buffer caregiver strain. One of my colleagues is going to be posting the links in the chat so you can follow along and have those available. So the first one we're going to talk about is Mass Options. For those unfamiliar, Mass Options connects older adults, individuals with disabilities, and their caregivers with agencies and organizations that can meet their needs in their local communities. The call center is open Monday to Friday and from 9 to 5, and the phone number will be in the chat. The other thing is the Family Caregiver Support Program. So that connects caregivers with caregiver specialists for free information, tips, resources, and customized care plans available to non-paid caregivers ages 18 and up, supporting an adult of age 60 or up. And anyone with Alzheimer's, dementia, and to grandparents and relatives age 55 and over, caring for children under 18 or an adult with a disability 18 to 59. To learn more, you can call Mass Options in the number that is in the chat. There's also the Caring for the Caregiver webinar series, which you are all attending today, but you can also view previous Caring for the Caregiver webinars, and you can view the pre-recorded sessions in the YouTube channel. And there's a variety of topics on those. To stay up to date on new webinars, you can sign up for the quarterly Family Caregiver Support Program newsletter, which includes news, resources, and updates for family caregivers. You will also be notified when registration opens for new episodes of the Caring for the Caregiver webinar series, which brings simple, practical solutions to family caregivers across Massachusetts. We also have the home care program, which provides care management, care coordination, advocacy, education, and in-home and community support services for adults 60 and older, people with disabilities, and people under age 60 living with Alzheimer's disease or related dementias. To learn more, you can also contact Mass Options. There's also caregiver support groups. Support groups provide family caregivers with knowledge, self care strategies, and support from their peers. These welcoming, supportive, and confidential groups are led by trained professionals and provide opportunities for caregivers to learn new skills, connect with other caregivers, and get information about community resources. There's also the Alzheimer's Association Massachusetts and New Hampshire chapter, which offers a 24/7 helpline and caregiver support groups, including dementia specific support groups, education on understanding dementia, communication strategies, managing challenging behaviors, and planning ahead. They can also help you find local resources and dementia trained services in your area. And last but not least is the Alzheimer's Association 24/7 helpline that I just mentioned. And that is a free service for people living with dementia, their caregivers, families, and the public. And you could connect with a live person for information, referrals, crisis assistance, and emotional support. Right. I know that was a lot of information, but next we're going to go to a short pre-recorded segment from Dr. Coll, who is going to share a clinical perspective.
Hello, everybody, and welcome to Caring for the Caregiver webinar as part of the Heart Health Month. I'm very excited to be here with you. My name is Dr. Maxwell Coll. I'm a physician at Brigham and Women's Hospital and Harvard Medical School, where I specialize in internal medicine and cardiovascular disease. And I'm also currently undergoing training there in electrophysiology, which is another niche specialty within cardiology that focuses on heart rhythms. I'm very excited to be able to talk with you all today about how you can care for yourself as a caregiver, especially when it comes to cardiovascular health. As many of you may know, in general, cardiovascular disease is the number one leading killer of adults in the United States. Um, That's just because the heart is such an important organ. It is really the uh, epicenter of providing the majority of your blood and nutrients to the rest of your body. And so being able to take care of that very important organ is going to make sure that you live a long and healthy life. Now, caregivers are at an increased risk of cardiovascular disease for a multitude of reasons. You all take such amazing time and care and dedication to helping those that you care for, especially those in the aging and older adult population. And I just have to say that I'm incredibly grateful to all of you for everything that you do. As someone who works with many older adults in my own practice, who has many older adults who require caregivers in his own family, I just want to say how thankful I am to all of you for all the work you do. Now, that dedication to your work can come with some sacrifices. There have been multiple studies that have shown that caregivers are at an increased risk of cardiovascular disease, and a lot of this comes from a couple of different things. One is that caregivers can be at a higher risk for stress and depression and anxiety. Those things specifically can lead to physiologic changes, especially hypertension. For those of you who don't know, hypertension is just a way of talking about your blood pressure, and it basically describes your blood pressure being too high. People with higher blood pressure are at an increased risk of cardiovascular disease. That's because as the blood pressure gets too high, over time, that can cause lasting damage to the blood vessels in your body as well as to your heart. It's just because it's creating more undue stress on the critical components of the cardiovascular system. And so caretakers, because they're at a higher risk of hypertension, need to take a little extra care to ensure that they are checking to make sure that do not have hypertension, and if they do, seeing their doctor to manage it appropriately. Now, there are certain signs and symptoms that you can look out for that can relate to high blood pressure. Most commonly, those symptoms include things like headache, nausea, vision changes, such as if you're having sort of blank or black areas over your eye, or eye pain as well. Some people can have chest pain or shortness of breath as well. These are all things that could be related to high blood pressure. If you're ever concerned about what your blood pressure may be, you can always go see a doctor and they will always check your blood pressure. Additionally, pharmacies such as CVS or Walgreens or any of your local pharmacies also carry over-the-counter blood pressure monitors that are quite easy to use at home and are automatic. And they can be a very easy way to keep a lookout for your blood pressure at home. And again, if it's ever elevated, which would be any number on the top over 130 and any number on the bottom over 90, that would be a reason to go talk to your doctor about if you need to start having some type of therapy that can help with your high blood pressure. Now, what else causes increased heart disease in caregivers? People who dedicate their lives to caregiving are also at increased risk of sleep deprivation, increased risk of having lack of exercise because of the amount of time that they're dedicating towards caring for people and not enough time caring for themselves, and nutritional depression, meaning that they are not having appropriate nutrition. All these things together can eventually lead to heart disease in different ways. And so let's take each of those one at a time. From a sleep deprivation standpoint, because of the long hours you may work, because of the demanding natures of your job, it can be very difficult to be able to have proper sleep hygiene. When I say proper sleep hygiene, I typically am talking about trying to at least get 7 to 8 hours of uninterrupted sleep at night. Now, obviously, this can be very difficult if you're also full-time caring for someone, but sleep hygiene is really important in the long term. People who aren't getting that 7 to 8 hours are at increased risk again of physiologic changes. This includes things like higher blood pressure, which we've talked about before. This also includes things like increased inflammatory markers in their body, which can also cause an increased risk of cardiovascular disease down the line. Moreover, the more tired you are throughout the day, the less likely you are to be able to do other things effectively that are good for your health, such as exercise and nutrition. And so that leads us into our next topic, which is exercise. Now, I don't think I have to tell many of you that the benefits of exercise on the cardiovascular system are incredibly well known, have been thoroughly researched, and have a huge benefit towards your overall cardiovascular health. In fact, exercise is so important that in people who have had heart attacks, one of the first things we have them do is go to cardiac rehab after they leave the hospital. This is so that they can start exercising in a controlled setting, which we know long term will help them recover from the heart attack and lead to an overall longer term heart health because of that exercise. And so, what kind of exercise am I talking about? It's usually a combination of both strength exercises and cardiovascular exercise, which are more on the endurance types of things. So things from on a cardiovascular endurance type of things would be things like the treadmill, walking, running, the elliptical, bicycle, anything that's going to basically increase your heart rate for an extended period of time, say 15 to 30 minutes. That would be a very good cardiovascular exercise. Strength training would include things like weights, which help to improve muscle overall. And people who have improved muscle tone and have muscle strength overall have much better long-term mortality from in general, but also from a cardiovascular disease too. And so you want to do a combination of things. Typically, I recommend people try to get exercise in at least 3 times a week for about 30 minutes. And this leads us to our final component, which is nutrition. Nutrition obviously is something that a lot of caregivers might skip out on because, again, you are focused so much on taking care of all the people that are in your life and all the people that you're responsible for. But that can also come at the cost of not taking care of yourself, especially from a nutritional standpoint. When people think of a healthy diet, they're usually thinking of it in terms of how can I lose weight? And immediately people start thinking about, well, I just need to cut carbs. And when I'm talking about a heart healthy diet, it's not just about carbs and cutting carbs. It's actually very important to think about the macronutrients that you are putting into your body. There was actually a great study that compared people on different types of low carb diets. And so they compared people in two different aspects, high carb diet and low carb diet. And then in addition to those people, they also further split them into people who were on a high red meat diet or a low red meat diet, including the carbs. And what they found was that people who were on a high carb diet, but we'll say healthy protein, such as fish and white meat and chicken, actually did incredibly well and better than people who were on a low carb diet but were having red meat. So this is just an example of why your macronutrients and where those are coming from are really important. I would say if someone were to ask me, if a patient asked me, doctor, what is the best type of diet I could be on for my heart health? And that's all they cared about. The best type of diet would be something called a whole plant-based diet. This is a diet that basically is primarily vegetarian, but can include lean meats such as fish. It has a lot of beans, has a lot of nuts, and other types of whole plant-based for proteins, legumes, lentils, things like that as well. Now, this is not a diet that everyone will want to be on, and it's not something that everyone needs to be on. I want to clarify that. But if you're asking me for what is the healthiest heart diet, it would be the whole plant-based diet. But in general, my best advice would be to try to have a balanced diet that prioritizes proteins that tend to be from leaner animals, such as fish and chicken, white meats in general. I would try to make sure you're having a well-balanced amount of fruit and vegetables, especially green leafy vegetables, dark green vegetables such as broccoli and spinach and kale. And then additionally, anything that has dairy products in it overall actually be healthy as long as it's not full fat, such as heavy cream type things. But whole milk can actually be very good for you, and yogurt can be very good for you, especially because of the protein and probiotics that are in that as well. Those three things, nutrition, sleep, hygiene, and exercise, are an incredibly important role for your overall heart health, especially in such busy lives that you might lead. It's important that you take care of yourself so that you can also take care of others. That is a mantra that we as physicians always have to tell ourselves too, that we can't take care of any of our patients if we're also not taking care of ourselves as well. Finally, I want to leave you with some advice about symptoms to look out for that could indicate a serious cardiovascular issue. The most important symptom would be chest pain, but chest pain that's specifically associated with stress or exercise is specifically worrisome. So if you are exercising and you start to experience chest pain and it's reproducible, so anytime you exercise or do any type of exertional activity and you're getting chest pain, that is a worrisome sign that you might have some type of significant cardiovascular disease and you should go and see a doctor. The chest pain most classically presents on the left side and can radiate to the shoulder or the jaw or down to the arm as well. Now, I say classically because not everyone has those exact types of symptoms. Actually, women and people with other types of diseases, such as diabetes, don't always have those classic symptoms. But the thing that tends to be most common among everyone is chest pain that is reproducible with exertion or exercise. And that would be a reason to go see your doctor as soon as you can. Well, that is our time for today. I hope that this was a helpful and informative session. Again, to review, we talked about important steps to take in terms of your overall health that can help with your heart health and help make sure that you are free of cardiovascular disease long term. The three most important things that you can do from an overall life hygiene standpoint is nutrition, making sure you're getting adequate sleep, and exercise. We also talked about the types of cardiovascular disease that caregivers are at highest risk for, which includes high blood pressure, and symptoms to look out for that, including headache, nausea, vision changes, and chest pain, and steps you can take, such as trying to get your own blood pressure cuff monitor from local pharmacies, to check your blood pressure, and then when to go see a doctor about that. And then finally, we talked about concerning symptoms to look out for that could indicate significant cardiovascular disease, especially chest pain that's reproducible with exercise or exertion. Again, I just want to say thank you to all of you. Everything that you do to help with those that you care for is incredibly appreciative. And I know how hard all of you work to be the best caregivers you can be. And I hope that these things will help you continue to be the best caregivers you can be and empower you to also take care of yourself. Thank you so much. And I wish you all the best of luck.
Thank you, Dr. Cole, for that helpful overview. We know this can all sound and feel like a lot. So we're just going to break it down into some smaller, concrete steps that, as a caregiver, may not seem as overwhelming for you all. So small actions have a big impact. We really want to stress that. You need to take care of yourself, but you're also taking care of another person. So we want to make sure that you know that caring for your heart doesn't require perfection. A lot of the things mentioned today are the goal. And yes, those are things that you should aim for, but we understand that that's not always realistic. We want to encourage you to have gentle habits. The big actions matter, but when your life is full of caregiving, small actions done often also protect your heart and protect the heart that is helping everyone else. So one of the things you can do is add healthy food. We've heard this before. We're just going to go into a little bit more detail as to some smaller steps you could take for all of these little things. So aim for an overall healthy eating pattern that includes whole foods, as Dr. Cole mentioned, lots of fruits and vegetables, lean protein, nuts, seeds, and cooking in non-tropical oils, such as olive oil or canola oil. So all of these actions will help support cholesterol, blood sugar, and inflammation. So some of the caregiver-friendly tips that may seem small but will add up are adding one heart healthy food a day. It may not be realistic for you to say to eat a completely healthy diet, but you can add or try to add one healthy food a day. Instead of cutting things out, you can add something in. You can add nuts or fruits or vegetables, and all of those will contribute to, taking those steps. Another thing you can do is you can swap out the cooking oil you're using to a more heart healthy cooking oil. So we want to mention that there is also a searchable library of heart healthy recipes. So when you are trying to think of what to make for dinner or you are trying to think of a new recipe, these are some realistic meal ideas for yourself or the person you're caring for. And let me tell you, a lot of them look very good. So there's different categories you can browse: breakfast, main dishes, snacks, soups, desserts, beverages, and more. And you can filter by your lifestyle needs. So you can say quick and easy, you can say budget friendly, slow cooker, vegetarian, and it will come up with some really wonderful recipes for you all. And the link will be in the slide. So another thing you can do is move when and how you can. We've heard, the 30 minutes of exercise, the hour of exercise, but we understand that sometimes that's not always feasible. So we want you to try to incorporate 10 minutes of walking, stretching, or light movement 2 to 3 times a day. What this does is it helps lower blood pressure, improve circulation, and reduce your stress hormones. So again, we understand this can seem like a lot, but there's a lot that you can do that you're already doing. So you can maximize the activity by turning housework into small exercise. You can vacuum and take stairs and laundry at a brisk pace faster than you normally would. You can try to count it as more of an exercise. Vacuum a little faster and then do a few laps with it. We understand that those are things you're already doing. So trying to incorporate that instead of, changing that. So another thing is walking or stretching more often. A thing you could do is if you're on the phone or you're watching TV and there's a commercial, try to incorporate some stretches. Try to incorporate, get your body moving in those times as a reminder for when you have a minute. So another thing is to stay hydrated. Hydration is a simple way to care for your heart. And it's just small, frequent sips throughout the day. So this helps support circulation and blood pressure. So yes, it's important to drink more often. And I'm sure that when you are caregiving, having a glass of water is not necessarily the priority. However, it is something that's very important. So try keeping a water bottle near you so you see it throughout the day and you can take a sip throughout the day. Have reminders to hydrate. Again, similar to the moving aspect. Try to think about, oh, I'm washing my hands. Let me have a sip of water now, too. Trying to incorporate it into your routine as well. And then try substituting your drink. Choose water or an unsweetened beverage over the soda, over the caffeine, the coffee, the sugary beverages when it is possible to do so. And as we heard Dr. Cole mention as well, we want you to get more rest. Quality matters more than quantity, but every bit of sleep helps. Try to go to bed 15 minutes earlier. Even those 15 minutes can do a lot. This promotes healing, improves brain function, and can reduce the risk of chronic diseases. So some things you could do, you can dim lights and screens. The phones now, you can set it so that there's nighttime mode and it automatically dims for you. And all this helps to signal your brain that it's time to just wind down. So again, turning the lights a little dimmer, turning the screens off. Also, taking a nap. I know we don't always like to think that we need a nap, but sometimes we might. When you're tired, short naps, 10 to 30 minutes, can improve alertness. They can really help you to make it through the rest of the day, especially if your nighttime sleep isn't as great or is limited. And then again, try to have a schedule. Our bodies really work on that schedule for sleeping. So if you're trying to go to bed and wake up the same times each day, that can make it easier to fall asleep and to wake up. And as Taylor had mentioned, quitting tobacco. You're more likely to quit tobacco for good if you make a plan and if you prepare. So start by creating a plan that fits your life and your stressors. What this does is it helps lower blood pressure, heart rate, and the risk of heart attacks by cutting out tobacco. So some things you can do if you feel a craving, try to wait it out 10 minutes, 10 to 15 minutes. Just try to you can look at the clock and just try to make it manageable by putting it off for those 10 minutes. And then that trigger may go away. That craving may go away in those 10 minutes. And if it doesn't, then the next time, maybe you can try to do 15 minutes and you can keep increasing it to prolong the gaps between that. You can keep your hands and your mouth busy. You can chew gum, you can drink water, which is, getting two of these things at once. You can squeeze a stress ball. You can do things like that, get a toothpick, I don't know. But also just take it one day at a time. Quitting is tough. It's normal to have cravings. It's normal to not have a straight process where you decide you're quitting and then you never do it again. Ideal, but not necessarily realistic. So, every 10 minutes that you last a little bit longer, just give yourself, the grace of that and just know it's hard and you're doing it. And that's what's great and important. So again, we just want to say the care you give every day is powerful. You know that, we hope. But these small actions, these small moments that you can do for yourself also help your heart and help honor all the individuals that you're also caring for. So again, it's not about doing everything correctly all at once. It's not about being perfect. It's about all the little things that you can do and the steps that you can take. So noticing what's possible, choosing those small steps and doing them over time is really what we hope you get out of this today.
All right. Thank you so much, Deanna, Taylor, and Dr. Cole for your informative presentations today. My name is Bella Santos, and I'm the Digital and Economic Equity Fellow with the American Connection Corps at the Executive Office of Aging and Independence, and I'm going to be leading our Q&A discussion today. So I just invite Taylor and Deanna to turn on their camera so that they can just answer a couple questions. But we're going to go ahead and get started. We welcome all of your questions, but just please note that we'll be addressing general topics rather than really specific or personal situations. If you need individualized guidance, we just encourage you to reach out to Mass Options, which I had put the number for Mass Options in the chat, as well as the website link earlier. And I just wanted to reiterate this, that we will be sending out all of the resources referenced in the presentation slides and in the chat to all the webinar attendees. But we really appreciate you all joining us today, especially with this very chaotic weather. So you can go ahead and put your questions in the chat. I know I've seen some comments, but if anybody has any particular questions for Deanna or Taylor, just let us know. Okay, Florence is asking if occasional wine should be eliminated from one's diet if they want to help protect their heart health.
I can jump in. I would just say the research is really mixed on alcohol. Sometimes red wine, for example, is a superfood for some people, and that's part of, the Mediterranean diet or Blue Zone diet. And then other times, the general guidance that I typically hear is no more than 1 to 2 drinks of alcohol per week. So that is typically what I hear. So again, this is all kind of mixed, but as long as it's in moderation, I think that is the number one goal.
Thanks, Taylor. I was going to say moderation and, doing what's best for you. If that one glass of wine a week is really, you look forward to it and it's helping you get through the week, you really have to weigh the pros and cons for yourself as well.
Okay, great. I know we have some questions here in the chat about brain health and dementia behavior, which are also obviously really important factors to consider when it comes to caregiving. And I just wanted to call out that if you guys go to our Caring for the Caregiver webinar series, we do address dementia and other aspects of physical health as well. So you can kind of look back on those to kind of get advice about what to do in those situations, since Taylor and Deanna are here today to primarily address heart health. But as a follow-up question for the wine comment, someone asked if wine is really not the way to go in general. And if there's any sort of replacement technique somebody could use for wine in their everyday life.
So again, as Taylor mentioned, I think in moderation, and there are mixed reviews as far as research goes. There's also non-alcoholic wine. If you just love the taste of it or want to have it more often, that's another way to go too.
Great. I see this other question as well that says, when caring for your loved one, if you feel overwhelmed and stressed and then get angry with your loved one, how can you handle this for yourself, and how might anger or stress impact your overall heart health?
I think that's a very valid question. I think we can all get frustrated, even with the people that we love most. I think it's important to, take those deep breaths, take a minute to just recenter yourself, do some breathing exercises, some mindfulness exercises, as Taylor had mentioned. Whether it's subscribing to like an app on your phone that has like some noises and can lead you through a mindfulness exercise. There's some on YouTube as well. Or if it's just doing, some counting in your head, or some techniques like 5 things you see, 5 things you hear, things like that, or the breathe in for 3, hold for 4, let out for 5. I got those numbers wrong, but if anyone knows, if they could tell me the correct ones. But really just taking that minute to take a deep breath and to try to recenter yourself, I think that can be really, really beneficial.
Definitely. And I would just add to that, these are normal human responses, right? Like, you are dealing with an extraordinary situation. Of course, you're dealing with all of your life priorities and your responsibilities, and you might be also caring for children and parents and things. So caregiving it can truly be a strain on your mental health. And if you really notice yourself having these reactions and you're noticing the physical responses, anytime you can just take a little pause, try to take a break and focus back on yourself. Like Deanna said, your breathing, maybe that's the time that you say, I need to go on a walk around the block really quick to, get the physical out. Or even on YouTube, if you look up 5 minute, 10-minute guided meditation for stress or for something, it just has you sit down and it has a very calm voice and it helps you control your breathing for 10 minutes. Those things genuinely really do work. It really does help you. 10 minutes later, you feel like you're in a different spot. So, anytime you can try to employ these strategies to help you is important. And over time, it gets easier. You have more tools to jump on.
Great. Thank you. Um, and then additionally, somebody is wondering if honey has any particular impact on your heart health um, in moderation.
I'm not
Yeah,
aware
my
of that.
understanding is really just focusing on whole foods, eliminate that processed sugar. So as long as these are like whole, organic, natural foods, it's much better than the processed um, sugars and things. So try to stay away from sweeteners, try to stay away from overly processed, over sugary items. So.
Great. Um, I just wanted to reiterate also, we'll be sending out some resources related to dementia care resources and some of the other concerns you all have brought up, but please feel free to drop in the chat. We have a few more minutes for questions about heart health and caregiving. I was also just wondering if you two could maybe talk a little bit more extensively about physical exercise. Um, and maybe talk about, I know Dr. Cole gave some ideas of exercises that you can do every day to kind of help your heart health, even if it's for, just 10 to 15 minutes. I know, Deanna, you gave some examples as well, but I wasn't sure if there's anything kind of bite-sized and easy for caregivers to do every day that they can incorporate into their daily lives that might be helpful.
Yeah. I can give an example from my own caregiving. I was a caregiver for an elderly person in the COVID-19 pandemic, and he was a big fall risk. So I felt really uncomfortable leaving the house or leaving him for extended amounts of time. So one thing I started to do was try to find like YouTube clips or a video that I could do something in the living room. I just felt more comfortable than going on a walk or even staying close to the house because almost every time I left, he told me he had a fall. So things like that. And I'm sure that's somewhat familiar to people. So anything I can tell you, if I tried to do something 3 days in a row, if I set that as a personal goal, it's much easier for me to form a habit. Habits are hard. I mean, even so, I'm not a current caregiver and I still have a hard time getting into exercise routines. I think that's a very natural human response. But really just try to start small. And what especially I think is helpful for me is start doing something you like that doesn't feel like a big challenge. Don't set your sets to like, I'm going to do the couch to the 5K. I personally enjoy walking. I don't love running that much. I'm not going to force myself to run. I'm going to give myself, um, I'm going to push myself or set goals around walking. I also have found that I like lifting weights. So I try to set goals around that. Um, anything that there are a multitude of free options out there. Anything you search on your phone, you will find. So don't feel like it's something that you have to buy a bunch of equipment or spend a bunch of money. There are many options. Again, focus it on things you like and that feel practical to you.
Yeah, Taylor, exactly. I know like some like TV providers even have some classes you
Mhm.
can take on demand. And it's one of those really big benefits of the internet and all the resources that we have at our fingertips. There's some really, really good videos out there, from Zumba to yoga, everything. And again, finding what is best for you, whether you want to have a dance party or you just want to
Yeah.
go for a walk. It's really finding what's best for you.
And then I will just add, as a research standpoint, one thing that's helped me maintain routines is like having the education and the background of knowing how it works. There is a multitude of research that's come out from studying Alzheimer's, from studying brain health and heart health over time. And it's found that anytime you even do 30 minutes of exercise a day, it it increases your glucose production for the next 24 hours. And that's super important for preventing diabetes or managing diabetes. So 30 minutes of exercise a day is going to have a 24-hour effect on that glucose levels, which we know are super important to heart health. So just when I remind myself, I'm so tired, I don't want to do anything, I can convince myself to go for a 30-minute walk because of that. Again, I'm not telling you this is everyone should do this, but having that kind of background of how exercise works, I think sometimes is helpful to motivate me personally.
Yeah, thank you so much for sharing personal experiences and then also just some additional practical ideas. But I just wanted to thank everybody again. That is what we have time for today. So thank you so much again, Deanna and Taylor, for answering some additional questions. And we will be sending out the resources from this presentation as well as some additional resources to help you all with your individual situations. But we just encourage you guys also to look back on previous webinar series that have been posted to our YouTube channel that deal with a whole host of different topics. But thank you so much for joining us again today. I hope you all stay warm and safe, and we will see you next time.